Hello, everyone. Thank you for coming. Many of you know who I am, and many of you don't know who I am. To make a long story short, I'm a co-founder. I'm sorry? Okay. I'm the founder of Compassion Works Medical, which is a medical food reimbursement consulting and patient advocate nonprofit organization. And I'm also the founder of Hearts Enteral DME. We are a durable medical equipment supplier. So not only do we help patients get covered for their formula, medical foods, supplements, dietary supplements, we also help, we just do whatever it takes to get it supplied as well. So you have it covered and you get it supplied at the same time. So I'm just going to briefly go through this. Okay, so again, we have a complex healthcare system, do we not? I mean, even if it's not for a rare disease and it's just for some sickness, other sickness, I mean, why do we have to fight for healthcare? Why? It's a broken system. There's just no way. There's no uniform way at all to fix this problem. But when it comes to rare diseases, that's when it becomes a little bit more challenging because you're getting insurance covered for medical foods. And that's extremely challenging. It's not something where you get a wheelchair covered and there's one unit, you get a wheelchair covered and that's it. It's very complex. There's no uniform way at all. There's a lot of different insurance terminology, HCPCS codes and service codes and all these different terminologies. People don't understand how to use it and therefore can miss out on coverage and slip off their diets and eventually end up in the ER or worse situations. So again, there's no uniform way for medical food coverage. Compassion Works has been helping patients for over 11 years coverage, and we also would prepare prior authorizations and help with billing discrepancies on behalf of DME companies. So we would help the patient get covered. Then we would do the prior authorization to ensure a smooth transition to a supplier to make sure that everything runs smoothly and the supplier doesn't really have to do much, but the patient gets their formula on a smooth level. But the challenge became worse and worse as the years went on with suppliers. The supplier industry just is cracking. In addition to Abbott and other different formulas, and we're just in a crisis right now. Am I right? Or it feels like we're slipping a little bit back instead of forward. So this is why I had to open up Hearts Enteral, because I was just tired of doing the jobs of other companies and preparing prior authorizations and billing discrepancies. I just put my foot down and decided, you know what, I'm just going to have to open up my own supplier, knowing that I have the background, many years background experience, and I'm a certified medical biller coder specialist. So I know how it works within the insurance industry and outside of the insurance industry. So we opened up Hearts Enteral. We became successful. We've been successful with Hearts Enteral for the past 2.5 years. We established a co-assistance program where we don't charge our patients co-insurance. We will accept every product on the market, whether it's new or not. It's not this type of place where we'll pick and choose because of low-cost reimbursement. It's not how we work. I know how low-cost reimbursement works. I know what program exceptions are. I know how to use the billing codes for medical foods, and I know how to get the products covered, because that's the bottom line. The bottom line is, okay, we have a great formula or product on the market. It helps our patients. How are they going to afford it? And who's going to supply it? And who wants to supply it? So if these companies don't understand how to bill for these products, they lose out and the patient gets dropped. That's what happened with Quorum. Quorum recently dropped all of their metabolic patients. That's it. They just dropped them because they didn't have any experience with medical food billing. And they would hire companies, outsource their medical billing companies, and they don't know what medical food is. It's a complex situation here. You know, it's not, people can't understand what that is. You can't just learn this in school. You can't learn this like it's some type of a 1, 2, 3 form. No, there's no form at all. So, so there again, it just became a challenge with finding a reliable supplier. But I do want to thank all of the other companies that do create new products for the rare disease community, and once it works, just making sure that you have someone that's ready to supply that product, and that's what we're here for, in addition to helping our patients afford and stay on diet. So we're just going to talk about a few topics here, just brief insurance terminology, how to find out if your health insurance covers medical food, B12, cobalamin, and where to look, how to file an appeal on your own, what is a health insurance waiver and how does it work, information about Medicaid and waivers, other avenues for coverage. If straight Medicaid won't pay for medical food, then what will happen? What to do if your supplier doesn't carry your formula or stops supplying your formula or supplement or medical food. Medical food exclusion removals from employers' contracts. How assigned case managers from insurance carrier could help with complex coverage support. And how to submit reimbursement to your insurance carrier on your own. Now again, we have a lot of different ways. There are assistants out there. There are navigators that work within medical food manufacturing companies. These are insurance navigators that will fight whatever it takes to help you find a supplier and check to see if it's covered. So that's one avenue for help or assistance. Another avenue is to work with your current supplier and check to see if they will be willing to stretch their neck out a little bit more and go above and beyond. All right, so with insurance terminology, honestly, without knowing the proper insurance terminology, understanding your insurance coverage can be completely confusing and frustrating. So we'll just start with some brief points of insurance terminology. So there are 5 typical points for brief insurance terminology. I'm not going to go through the whole slide here, but it's basically service codes. What is a service code? Okay, that's an insurance terminology that is used actually when verifying insurance benefits. So when we verify insurance benefits, instead of I'd like to verify insurance benefits for my medical food or my formula, it's I like to verify insurance for my certain service codes to see if they're valid and billable. And what's a service code? It's a CPT code or HCPCS code. Either way, you see how this can be confusing? Because naturally people understand, oh, it's a HCPCS code and they stay in that area. No, it's actually a service code. It's a simple word for that in the insurance area. What is in-network and out-of-network, the difference between prior authorization and predetermination, diagnosis-driven plans, state mandate coverage, and other words. So how to find out if your health insurance covers medical food, formula, B12, and where to look? This was a question, I believe, from Kathy in her area, and Danae thought that this would be helpful to the community. Well, let's start off with commercial plans and your employer plans. Some of you may already know this, but I'll just go through it again. If you have a commercial plan, the best thing to do is to read through your benefits plan booklet, or it's called evidence of coverage. Go through that and look for exclusions. As soon as you get to the exclusions part, that will tell you everything, whether your medical food supplements and whatnot are covered. And once you get there, you look for certain words like medical food formula, enteral, oral, supplements, those words like that. And if it's not there, then usually that's a good sign, right? Others are what's covered under the exclusion section. So when you're reading your plan, your evidence of coverage policy or benefits plan booklet, you may overlook certain little words that may be there under the exclusion section. So these little words are may or unless, except. That is very important because you can overlook that and think, oh, it's not covered, it's not covered. No, 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 it says may or unless. So that could fall under a diagnosis-driven plan, which are plans that only cover if it's diagnosis-driven. So for instance, usually medical foods are only covered for inborn errors and metabolism diseases. So you need a diagnosis code for that, which is, I believe HCU is E71.1. And you ask the insurance specialist, does this fall under the E71.1? And they'll say yes. And that's where it becomes a diagnosis-driven plan. It could easily be mistaken as a non-covered item. Then we have Medicaid state plans. Anybody here that has Medicaid? You could raise your hand. No, Medicaid, 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 okay. So you want to go now to your Medicaid policy and find out, okay, how can I find out what is covered under my Medicaid policy? The best thing to do is to go under provider resources and check for the DME benefits, which is durable medical equipment benefits. Typically, medical foods, enteral formula, and supplements fall under the durable medical equipment benefit. Sometimes they'll fall under nutritional support, or I'll have a separate section just for medical foods. But overall, it's covered under durable medical equipment. So if you have Medicaid, go to provider resources, look up the DME benefits or durable medical equipment benefits, and there you will find the DME manual. There's also a fee schedule, so don't get confused. It's under the manual, DME manual. And you search for the words under that manual if you know how to do so. And it'll bring you to that point of the coverage, what's needed, what documents are needed for a prior authorization, if it needs a prior authorization, what's not covered, which you can go to the non-covered section. Okay, has anybody ever filed an appeal before? Raise your hands. Okay. For anything else, how long do you think that process is? Exactly, and it could be very frustrating because here you have, you have this, or you have a child that has a rare disease and they're fighting to basically survive. They're not, trying to, they can't understand what's in the insurance policy. So I'm just going to give you some basics of how to file an appeal on your own. So typically there are two levels of appeals that you can go through. The first appeal is the independent external review appeal. And the second is the external review. So the first thing you would do is, which is highly recommended, make sure you write a detailed appeal reconsideration letter. Because if you don't have all of the specifics in your letter, they could just cancel you out. So you want to make sure you have everything up front the first time to try to avoid that denial, right? Does that make sense? So here I just gave a few pointers of what to include in your reconsideration appeal letter. And all of this is recorded, and you can find this on our website also. I have templates and tools and other handy information that you could use on our website. But it is important that you make sure that you write out a detailed appeal reconsideration letter with these pointers that I had pointed out here. Making sure you have your member name and ID number, provider number, dates of services, HCPCS codes, which is service codes. And if it's for pharmacy and you're fighting for pharmacy appeals, that's another story. But you would use the NDC code for pharmacy. And a copy of the original explanation of benefits, voucher, or bill that you received, medical records, which is highly recommended, the letter of medical necessity, prescription, anything that you can throw in there the first time to avoid that denial process. Now, if you get denied, then there's a process here. If your first appeal is denied, then you have the right to file a second appeal. And from there, you'll have instructions on your appeal letter the first time. It'll tell you what to do if you don't agree with the initial denial. You follow the instructions letter, and you must file your second appeal letter within 180 days from the date that the denial letter was sent to you. From there, if it's denied again, don't give up. I know it's frustrating, but don't give up. Don't give up. Keep going. Keep going. There are ways. There are ways to work around coverage and other avenues of processes to help you afford and stay on diet. So I just threw out some other processes out there. You can file for a grievance decision. There are support programs out there. There's the Department of Insurance Commissioner. It depends where your state, where you reside. There's the Consumer Assistance Program. Speaking about programs, there are also different programs. If you have Medicaid, there are waiver programs. There's so much out there that a lot of people don't know about. They just think, oh, well, we'll set up a little fund here and that's it. No, there's so many avenues of coverage a lot of people is not aware about. Okay, so has anybody ever heard of a waiver? Insurance waiver? Yes? Okay, go ahead, Jess. What's an insurance waiver?
It's a form that you can fill out, and even if your thing is out of network, you can fill out a form where it can become in network because we don't have the suppliers.
That's called a gap exception. Yes, that's okay. But that's okay. That's cool. We'll get to that part. But yep, that's very helpful. That's certainly helpful. Waivers are just basically to get out of your current insurance policy with your employer or your school or whatever. So let's say if your employer's policy does not cover your medical food or supplements, then maybe you might want to opt out of that insurance plan and find another insurance plan somewhere else and pay a premium for that in another avenue. So basically, that's how that works. It's a waiver. It's a form that you submit to your employer, or they might have a form you could fill out asking to help opt out of your current insurance plan that you have now with your employer. So then this way you could either choose another plan or maybe add on to your spouse or whoever else's insurance plan. But there are other ways to opt out and get into another insurance plan. And if you have Medicaid, there are just certain types of different Medicaid waivers. There's freedom of choice, there is home and community-based services, and there's Section 1115 research. These waivers help patients that are not eligible for Medicaid. So here are patients that apply for Medicaid and their poverty level is low. They feel that it's low, but they still get denied, which is unfair. Again, part of our broken healthcare system. So there are waivers in place for that. You would just need to check with your state and find out which waiver works best for you. And here I have some areas that you can go to and check to see if your state has a particular waiver, which would usually fall under the Section 1115 or the freedom of choice. Okay, so what to do if your DME supplier doesn't carry or stop carrying your medical food or formula supplies? Well, it could be frustrating when your supplier doesn't supply your nutritional products, as we know, right? And they drop you. So the first thing is to contact the manufacturing company, ask for navigation assistance. Go to your insurance carrier's website and search for an in-network provider on your own. Ask for a recommended DME supplier through social media, as everybody has been doing that already. Find an out-of-network provider instead of an in-network provider. And that's where we come into the gap exception. And ask if they could provide a gap exception, in-network waiver from your insurance carrier. Now, so what is a gap exception? A gap exception is for out-of-network providers with insurance carriers. And what they do is they ask the insurance carrier if they could have an in-network waiver and collect under the in-network benefits versus the out-of-network benefits. Typically, if there aren't any other suppliers that carry a particular product within a certain mile radius of where the patient resides, the insurance carrier will grant you, the out-of-network provider, an in-network waiver. And really quickly, for the supplier's benefit, it's actually better to have things covered as an out-of-network than it is in-network, because you're confined into that one contracted plan. If you're out of network, you get to create a single case agreement, you get to negotiate the prices up front, you submit an invoice. It's more profitable that way. So it's profitable not only for the company, the DME company, it's also a win-win situation for patients as well. And if you just want to skip the DME overall, then you can just basically purchase it from a manufacturer, find out they have a discount from the manufacturer, and then submit reimbursement on your own and forget about all the DME stuff. And the next is contact your insurance carrier and try to work with your pharmacy benefits. I know it's difficult with pharmacy, and we know that medical foods and supplements are covered under medical, mostly pharmacy. That's where it becomes tricky, because pharmacies, it's tricky because they have a formulary list, or they go by a system. They have a pharmacy system that they go by, and if it's not there, how can they even provide it for you unless they work out some special arrangement and they can provide you your pharmacy medication. But there are formulary exception forms for pharmacy. So if your product is not listed on the pharmacy formulary, then your doctor can ask for a formulary exception to help add that onto the formulary based on your medical necessity need. Now, that takes time to do that. And there are a lot of companies out there that work under the pharmacy umbrella that don't want to even go that route because they feel that it's too much time. It's just not covered. Let's find a DME supplier. No, it's only once. That one patient. You don't have to keep doing it again and again. So if you get a formulary exception for that one patient, it's good to go. You don't have to keep doing it again and again. But there are companies that don't prefer to do that. So in other words, then you would fall under the DME benefit and get things covered under medical. Okay, so we're back to exclusions. Exclusions, how to remove from your employer. If you have an exclusion on your employer insurance plan, then you would need a medical food exclusion removal letter, which I have on my website. It's a template you could use for yourself. Take it and use that and submit it to your HR department, and they could help you remove the medical food exclusion that's on the contract between your employer and the insurance adjuster. Typically, employers that have over 150 people, they probably can't remove that, or else they'd have to do it for everyone. So if that's the choice, still don't give up, because there are other options. I know, been doing this for years. There are other options. There is no coverage in my book. There is no in my book. I don't take no for an answer. This is why we had to create Hearts Enteral as our own supplier. There's no such thing as no, because I know that there is, based on my actual experience with over hundreds of patients that I've helped. and clinicians that I've helped over the years that know me. You don't learn that in school, you have to learn hands-on, right? So another way for help is asking for an assigned RN case manager. Does anybody know what or has an assigned case manager right now, patients? You do? Okay. And how helpful is the assigned case manager?
My assigned case manager is very helpful. She helps try to push things through when we get fire offs and things like that.
Okay. So when patients have a complex situation with coverage and with their plan, the best thing to do is to have an assigned case manager so they can work inside the coverage area, your insurance policy, and try to get things covered based on medical necessity. A lot of people don't understand what that is or don't even know, but I highly suggest that patients ask for a RN case manager within their insurance plan to avoid any types of denials or non-coverage or help with assistance for coverage for your medical foods and supplements.
Just going to say, too, the case managers have been helpful with navigating the amount of time that you would spend on the telephone with trying to coordinate and seek seek out this provision of whatever you're seeking. But I just feel like the case manager, I agree with Raenette, has been very helpful. Just the amount of time that we would spend trying to get something covered. They can really navigate that system for you, get back to you, seek your information, the reports or whatever for the approvals.
Right. Thank you for that. No, that's very helpful. And I work with the insurance, RN case managers, and they would, whatever information I need, they would submit it to me, and I would supply their medical food supplements. And I mean, I hate to repeat myself, but there are more products or treatment for rare diseases than just formula, right? There's the B12, cobalamin, which is highly important. People suffering with trying to inject themselves maybe 2 or 3 times a day. You know, that's uncomfortable. You know, it's uncomfortable. And that's why we step in, because we have a heart, we have a passion for helping people. And it's not fair. So we're going to do whatever it takes to find a way, or simpler way, to make their dietary or nutrition assessment more comfortable. Is there another way to get your cobalamin shot? Is it an old theory that came out many, many years ago that the injection is more highly potent than anything else? I don't know. But I'm here to work with any company that's willing to work with me, right? I always believe there's something else better out there that could be more comfortable for the rare disease community. And that's where we are. Never give up. Be persistent, being as specific as possible about why, what, how, including as much evidence as you can. Communicate upwards, downwards, and sideways. Because all we have is each other. We have a healthcare that's broken. The system is broken. Broken. We could have all these beautiful products on the market, but can these distributing companies make money and help support the patient stay on their diets? That's when we come into play, because we just focus on medical foods, supplements, enteral nutrition, dietary products. That's it. Nothing else. This is our whole world. So we just need to stand together and find other ways that's more comfortable, more affordable, and to prevent these patients from slipping off their diets and staying on their diets and liking their diets and loving their formulas and supplements and being happy about it. That's where we are at this point. Any questions? No? Yes?
First, I just want to thank you for being such an influencer in our community. I
Thank you.
Personal experience from the last 7 years.
I helped her son.
Lifesaver. Because I even do part of this as in my job as a nurse, and I find it horribly frustrating, confusing, time-consuming. It's an entire job for a parent to have to do that, and you have been amazing helping out, knowing the ins and outs, and you don't quit. I've never seen anybody be
Thank
so
you.
persistent. So I thank you for that.
You're very welcome from the bottom of my heart.
But I'm going to hit you with another question. We were just discussing the Medicaid aspect of it. And I know there's, we all found out there's things individual families know about that it hasn't gotten out there. Are you familiar? So we have in the past couple of years found out that you can take Medicaid as a secondary when you have commercial insurance. And it covers a lot of those deductibles, co-pays for homocystinuria because it's a chronic condition. And it's a lifelong treated condition. Has nothing to do with finances. And now we're in the state of Pennsylvania. So we were trying to figure out, is that a state-based understanding or?
That's across the board.
It is across the board.
That's across the
because
board.
that has been a life changer for us. You have commercial insurance, but then it's, $5,000 deductible, co-pays, can't get coverage.
Can't get
Through your
coverage,
commercial, they'll
right?
deny you.
There you go.
Medicaid will jump in and cover it for
Dual
you in
coverage.
the meantime. So yeah, we were just talking about that, and I don't know. I know we fought it for a while. I would say, having a son, you're 10, 15 years ago when Denver told us, get on Medicaid. I'm like, it'll label them with a disability. We don't want to do that. It has been huge because, then coverage,
Yes.
being able to stay on diet, being able to stay on medication is really what it's all about. So I just thought, thank you for answering that. I didn't know if
Very
that was
welcome.
part of.
You're very welcome. And just to let you know, in the state of Pennsylvania, they waive deductibles. So the state
Always
mandate
something new.
waives deductibles for insurance coverage for medical foods and supplements. They do. So you don't have to pay a deductible. You have to pay your co-insurance, but you don't have to pay your $5,000, $6,000, $100 deductible, no. As long as it's a fully insured plan. But if it's a self-funded plan, sometimes they can honor it if you ask.
I was going to say, we run into that too, where you have a commercial plan that's a carve-out for the company that my husband works for in California. They don't have to follow Pennsylvania rules and stuff.
They don't have to.
Work around for that too. I should.
Of course. I have everything for that. No worries. Yeah, you're very welcome. And tell Will Auntie Ray says hi. Okay. Any other questions?
Yes. We have talked, both Bharat and I have talked to you before regarding the same issue that I'm talking about. This is regarding his seizure medication. See, the thing is, for him, this is only the brand name seizure medication worked in controlling his seizures. The last 7 years, he's been seizure-free, only because he's been taking that particular medication. But the insurance company switched, my husband's company, which is covering his insurance, they changed the insurance. Now, as of last year, he's been paying $1,380 every 3 months for the medication, which costs only $150. $180 for 3 months. And they are denying it and putting on the penalty so that he pays $1,380 for getting a brand name medication. For generic, for the same medication, it's only $20. So we tried appealing it 3 times when we were in touch with you also.
Right.
We tried everything. They are still denying it. Go on generic or else pay the amount.
This is a pharmacy benefit.
This is a pharmacy
This is
benefit.
straight up pharmacy benefit. This
Yes.
is not anything to do with the medical food or this is his medication, his seizures. As I mentioned before, pharmacy is tough. It's a whole different ball game. When you hear things are getting covered as far as medical foods or supplements, which I consider medical food a medication because it's designed for a certain disease. So for me, it's a medication, right? But it's just falls under that medical food through the Center of Food and Safety Administration. So with the FDA, if you have a medical food product that's labeled as medical food, it does not have to go through the FDA and their compliance, all that compliance for drugs. Like that's a different story. If it's labeled as a medical food, it's a medical food. All you need to do is register that company, and that's it, because they need to know that that company and your products are there. But no compliance like running through the FDA and compliance and trials and none of that for medical. So these things are different. It's a whole different ballgame between pharmacy and medical. If there was a way to get his seizure medication covered under medical, that's something you may want to investigate or talk to your insurance company and see if this can fall under a medical benefit based on his medical needs. But that will be very challenging because this is a drug.
See, the thing is, I've even gotten support letters from his neurologist and also from his geneticist why he's got seizures in the first place because of the homocystinuria. That's the, in fact, he was diagnosed after the seizures and we were told because of that. And I've given letters that if he changes the medication, he'll have breakout seizures. And he has had it in the past years. He has changed so many medications. I've submitted all of the letters from the doctors, everything. They are still denying. Go on generic or else pay the amount.
Okay. How about switching off of that insurance plan? Just get out. Get out. That insurance plan is not working for you and your family, and he's paying way too much for it.
That's the only one medication. All the others, we don't have any problem. So I am kind of like worried about.
Right. See, that's the worry, the fear is what stops people. You never know. You can find another health insurance plan that may be even better for his other medications than what you currently have now without trying. So instead of opting in right away or jumping to the gun, you should navigate what's out there first. Compare what you currently have to what is out there, right? And if you find something similar or better, get out, opt into that so he can have his seizure medication covered. If you need help with that, choosing a plan, see, that's a whole different ballgame. You call me and we'll go through it online and we'll do a comparison. Okay. And we'll find a better plan. That would be the best way because this has been lingering on way too long and your fear has been stopping you from moving forward to another plan. But you want to make sure you opt into a plan first that will cover and do a comparison. So let's do that. We'll talk about that. You can give me a call tomorrow or whatnot. Send me an email and we'll set up an appointment call and we'll go through the different plans. This way you'll have it, so it'll ease your fear a little bit more. And that's probably the best choice at this point.
You also mentioned about Department of Insurance.
Yes, you can go back to the slides or the insurance, and you can go to the Consumer Affairs. Okay. That's another avenue that you can take. But don't let your fear stop you. This is all your insurance plan's fault.
Okay.
You did your part. You're welcome.
We have another question over here.
Hi, thank you again for being here.
You're welcome.
I met you many, many years ago, I think at a Southeast Regional Genetics Network conference, and I have since passed along your information to numerous patients. I recently started the Mississippi Metabolics Foundation. I'm in Mississippi, and so you probably know we have no state assistance for formula coverage or medical foods. So we have a lot of patients that are going off formula because most employer-paid plans are Blue Cross Blue Shield in our state. Of course, it says in our Blue Cross Blue Shield policy, medical foods, medical formula are excluded regardless of medical necessity. So we've had some patients that have been able to get it covered under the DME, but I do believe that the way that they did that was their doctor actually said that they took it enterally and not orally, which they don't have a G-tube, and that was the only way they could get the insurance to cover it. So I don't quite know why they can cover it, you know, whether you take it through a G tube or NG tube or whether you take it orally. That's just very confusing.
And it's unfair.
Yeah, I mean,
it's unfair. I mean, obviously, it's going to be an oral.
Right. And I mean, we fought for years and years for my daughter to not have a G tube. I mean, we sacrificed time, sleep, everything to feed her, you know, 1 or 2 cc's by syringe just to get the formula in her and to keep her where we didn't have to worry about that extra complication of having a G tube. So I'm still sending patients your information because I know that you can help them navigate that.
And I can supply their food as well now.
Yes.
Through Heart Central. So not only helping, I can also supply their food.
Okay, I will
and
definitely.
I have all the medical, all Blue. I love Blue Cross Blue Shield. I never have a problem with them.
Okay, well then, speaking of Blue Cross Blue Shield, what about the federal employees plan?
I know how that works too. They used to have a really tough mandate for. It went back and forth. Then it was just 1 year they were covered under pharmacy. This was only under pharmacy with federal. And then there was a point where they could get it under medical. So I'm familiar with federal.
Okay.
plans.
Well, we're actually probably going to be calling you soon.
Okay.
My husband just recently took a job, a federal job. So we went from a regular Blue Cross Blue Shield policy to a federal Blue Cross Blue Shield policy. And they are saying that the formula, because she takes it orally,
Okay, I'll explain that. I'll explain that. Okay.
is not covered. And they were trying to say it was falling under the prescription plan, and it was not medical.
Right.
So, you know, we're trying to get this quite figured out because this is a whole new plan. We've had our other plan for, 12 years. So we're having to relearn. You would think Blue Cross Blue Shield policies would be the same across the board. No, the federal plan is totally different than other employer-based Blue Shield policies. So I'll probably be calling you about that because they are trying to make it under prescription and under the pharmacy benefit and saying that that's so. Okay, well, I will be contacting you in the next week.
All right.
Thank you so much.
And just so you know what the difference between language, insurance terminology, enterally generally means it's being fed through a feeding tube. But as I mentioned, there is no uniformed way for medical food coverage. Yes, there are these words. Then it depends on who you're speaking with. The person is critical. The benefits specialist that you're on the phone with or the supervisor, that's critical because you can get different answers from different people. My job is to correct them. I correct them. When it comes to calling up claims and they're trying not to pay me, which I make sure that I have all the information to avoid the denials, but if it happens, I correct them. Because they don't know what medical foods are.
Yeah,
they don't even
they
know
don't.
what enterally is. I mean, my company's Heart's Enteral. A lot of people think it's Central or, whatever. No, it's Enteral,
Yeah.
So, I mean, that's another reason why I chose that word. Because it's difficult and there's no uniform way. There's no uniform way where it has to be this way or federal or this. The only way it's a uniform way mostly is if it's a Medicare plan because you have assigned HCPCS codes that need to be assigned through Medicare patients only. Not Medicaid and not commercial insurance plan. They have their own policies. Whenever you hear an assigned HCPCS code, that's just for Medicare patients. A lot of companies and people get confused or DME suppliers, it has to be assigned. No, there's no uniform way, my friend. There's no uniform way. So let's say if your doctor has to put in the note, it is fed enterally or, the little word, orally to get it covered, then that's how it is.
Yeah, I think that's what some of the Blue Cross Blue Shield policies, they've had it written that way.
I have letters from doctors that way. Yep.
So that they've been able to get it. But
No
I know the
uniform
Blue
way.
Cross Blue Shield federal policy that we just recently got is saying if she takes it orally, it's a pharmacy
Yes.
benefit. If she takes it enterally,
Yes.
it's a DME benefit.
Right.
And they will cover it as a DME benefit, but because she takes it only orally, it's not, it's an exclusion under the pharmacy
absolutely
benefit.
right.
So
Absolutely right. But we can
it's
work around that.
confusing. Yeah.
Oh, uniform
I
line.
mean, you know, you work hard to keep your children healthy and provide the
course.
formula
And that's why I'm here,
And,
to
you
help
know,
alleviate that burden for
yeah.
you, right?
And the insurance companies don't understand, if you have a child that's having to take it enterally with a G tube or GJ tube, they're actually having to pay more money. So you're actually helping them by keeping them without having that, you know, tube feed, because the insurance companies would have to pay a lot more for the care of that child than if the child just took it orally and, you know, they help subsidize the cost.
It's a communication gap on these. They just don't understand anything about this. It's a whole different world to the insurance companies, and that's when I come in and help explain how it works on the insurance aspect. But I'm here for you. Hearts Enteral is here for you. Compassion Works is here for you. And whatever.
Well, thank you, and I appreciate, you know, all that you do. I know with my foundation, that's one of the struggles that our families in Mississippi have, is with patient, you know, coverage for their formula and not
we
being.
don't charge co-insurance.
Okay.
So.
I'll definitely keep you in mind.
Of course. All
Thank
right.
you.
Happy to help.
All right. Do we have any other questions? All right.
All right, Brian.
No, I just wanted to say thank you for all you do, like, for everyone.
You're welcome.
Yep. Do you want to say anything, babe?
Yeah, you've been like a lifesaver for me. Because
Yes,
when
PKU.
I got married, I was freaking out. I was like, "What's gonna happen? I'm gonna lose my insurance." I had no idea, no idea. And then I reached out to Raenette from a friend of mine. So that's how I met Raenette, and Raenette's just been an angel. Like, she's just been so helpful.
Glad to help.
Yes, thank you.
Anyone else?
I think Jessica wanted to come up and say something.
All right. Let
It's just, we
Jessica.
have like 3 minutes.
So, Raenette has helped me in multiple ways. My parents, I have a homeless assistant area, and my parents fought and fought with insurance companies, and they were like, "No, we're not going to pay it." About 3.5 years ago, Raenette and I were talking, and she helped me get the HCU tabs paid for by my mom's medical insurance, and also got my medical food coverage about 2 years ago. And it's just been really helpful because finances are hard, as you guys all know, and medical food is not cheap. But and Hearts Eternal and Compassion Works has been truly a blessing when it comes to coverage and just making sure that I have what I need. You're welcome.
Okay, that's it.
Any other questions? All right.
Thank you.